Hello everyone, welcome to this session on societal issues concerning the applications of AI in the medicines. Artificial intelligence is transforming the healthcare from diagnosing the disease to the personalizing treatments. But this innovation comes deep ethical and social questions. Who benefits from medical AI and how the decisions will causes the treatments and what happens when the technology goes wrong. Let's explore these important topics and issues together. Just to do the quick recap why this matters. Before we go further, let's understand why this topic is matters today. AI is already present in hospitals, which helping the doctors with diagnosed tools and treatments, as well as the planning and predictive of the analysis. So the healthcare AI market is expected to nearly reaches $188 billion by 2030. But growth alone is not enough. We must ask who really benefits this and who decides how the AI is used and what risk does it brings to the patients as well as the society. So these are all the questions guiding our today's discussions. Next, do the mind map activity. What concerns you? Now, take a moment to think when AI becomes a part of healthcare, what concerns you most? Is it privacy, where the patient's data could exposed or misused? Or is it cost, where the advanced technology may be unaffordable? Or maybe the access with the rural or the poor regions left behind? Maybe you are thinking about the ethics or job replacement of healthcare workers. Each of this is a valid and serious concern, and together they define the societal challenges of AI in medicine. Next is understanding these challenges. So, what makes the AI in medicine so complex? Unlike other fields, medical AI deals with life or death decision. It affects the populations, the sick peoples, and the early are also the disadvantaged. There are ethical trade-offs like balancing the efficiency with compensations, and rapid technological changes often the rules and regulations of ethical AI. Ultimately, AI is not only about dealing with data and algorithm, it's about the people, values as well as justice. Next is who affected, and also we can deal with some real stories. Let's look at how impacted by AI in medicines. Patients worry about the privacy, fairness, and losing the human touch in care. Doctors and the healthcare providers faces the challenges around the trust and accountability. Who is responsible when AI makes the decisions or a mistake? And the communities experiences the inequalities. So when AI tools are available in cities but not in rural areas, or when the culture difference are not reflected in those data, every stakeholder has a role and every voice matters in shaping the ethical AI. Next is defining the core problem. We have four main societal problems linked to AI in the medicines. First one is the algorithmic bias, where the AI trained on limited data and can be misdiagnosed certain populations. For example, a skin cancer AI was also found to less accurate for darker skin tones. Next is the data privacy, where the medical data is valuable but sensitive. And next we are dealing with the access inequalities. There the advanced AI tools often exist only in wealthy hospitals, deepening the healthcare gaps. Next is the accountability. So when AI makes the wrong decision, who is legally responsible? The doctor, the company, or the softwares? These are all the core issues that demands the ethical as well as the social attentions. Next is imagining for the better solutions. To solve these problems, we need the innovation guided by the ethics. Start with the inclusive designs, train the AI system using diverse data from all the populations. Ensure privacy by default, building the systems with encryption, consent, and also user control built in. Promote the equitable access through the government funding and also the public private partnerships, so all the hospitals will get this benefits. Next is establishing the clear regulations. By this, defining the accountability and the ethical standards for the AI in the healthcare. The goal is simple: make the AI work for everyone. Next is testing the ideas. So how do we know each that is the solutions will work for the best? Let's look at the real example experiments. That community partnership helps to ensure that AI tools must meet the real healthcare needs. And the buyers regularly audit to test the algorithms and also find the unfair patterns. Patient Advisory Board gives the patient's voice in how the AI tools are developed and used. And for the failures, we learn that technology alone is not enough. Human insights must guide at the every stage of AI development. Next, moving forward, the future of AI in the medicine requires the collaboration as well as the awareness. We need the education and training so the healthcare workers understand how to use it AI responsibility. And continuous monitoring ensures the AI remains fair, effective as well as safety. And certain privacy policies developments must keep the pace that protects the patients while still encouraging the innovations. So together we can build a balanced, ethical and a future for AI in the healthcare. Let's wrap up with some of the key takeaways. AI has enormous promises. It can deliver faster diagnosis and smarter treatments as well as the better outcomes. But the societal issues like privacy, bias, access, and accountabilities are the complex and going on. As a future professionals and citizens, your role matters. Whether you are designing the technology, using it, or simply benefited from the technologies, and ask yourself how you contribute to making the AI medicines fair, safe as well as compensating for the humanity. These answers will help you to create the future ethical AI in a better way. Thank you.